Hi, guys. It's Dr. Shelley, and it is Friday, July 10th, and it's 4 o'clock. So it's time for us to talk about all things COVID together and have a recap on been going on over the last week. As you know, it's hasn't been a dull moment here in Florida. So what we'll do is kind of give an update on what's going on. Since the rest of the world is constantly looking at us now, as now becoming the number one hotspot in the country for COVID 19. Although, certainly we are, California is not very far behind. Arizona's up there, all the Sun Belt, Texas. So it's not like we are by ourselves in this. Predicament. Hi, Karen. So let's go over some our basic numbers. We actually do that every week. And once again, for anybody that doesn't know me already, I'm Dr. Shelley Glover, and I am a board certified gynecologist who also practices anti-aging for both males and females, as well as hormone balancing, and I specialize in sexual health, as well as doing your basic gynecology as well. My office is in Claremont, Florida, which is located within Central Florida. And that is, for those of you outside of Florida, it is the Orlando area, which is where the House of the Mouse is. So, speaking of which, Disney is now officially completely open. It was our I don't know what you want to call it. We call it Disney Springs. It's basically where the food courts and the stores are and stuff like that. That had been open, but the actual all of the parks are now fully open. They are requiring masks the entire time. But they did decide, even though the numbers are increasing, to go ahead and proceed with opening. So all of, as far as I'm aware, and unless anyone else has data that I'm not privy to, all of the parks in Central Florida are open for business, but they do have their restrictions in place, including doing temperature checks, requiring masks at all times, unless you're actively eating. And if anybody in the group has an elevated fever, then the whole group is not allowed to go into the park. And once again, that's for everybody's safety. And even though it's a pain to wear the mask, it's a small price to pay for keeping everyone healthy. And if we're going to have a lot of people in, lumped together, we have to do what we can to protect ourselves and others. So our latest COVID data for this week, the cases are up to 12.4 million. That's up from 10.9 last week. And within the United States, we're at 3.2 million. And Florida has increased to 244,000, up from 178. So that's a huge jump, which of course we knew was happening because we've been seeing the numbers as the testing is going on. The numbers have been exponentially increasing. Death rate, as far as the number of deaths worldwide, it's up to 557,000. That's basically about 36,000 more deaths in the last week worldwide. Within the United States, we're at 136,000, which is about 5,000 more deaths. And within Florida, 4,102, which is approximately 400 more deaths. Survivors, 6.7 million worldwide. So that's the good thing, is that we have 6.7 million that are considered fully recovered. But that's only half of all the total cases across the world at this point. That doesn't mean that half of the people died. Let's get that straight. That means that half of the people are either actively ill, still in the asymptomatic stage, but still testing positive, or have passed on. So that number encompasses all of that. Within the United States, we have 955,000 who have recovered. And been labeled recovered, but that's, once again, we have 3.2 million cases, so that's less than a third of the cases that are considered recovered at this point. Hospitalizations in the state of Florida are up to 17,602, which is 2,000 more than we had last week. So, we always go through this, what do the numbers mean? Okay, there are people that say, well, the more you test, the higher, the more people you're going to find. Uh, that's true to a certain extent, yes. But what we're seeing is a significant increase in the number of people being hospitalized. You can't make those numbers up, people. People do not go to the hospital just for fun, and especially in this day and age. So people are going to the hospital, and hospitalizations are going up for COVID. Then that's a real problem. That means that people are actually um, ill, and we're running into the problem that we were trying to avoid with the whole quarantine. So let's refresh our memory because it seems so long ago that we actually were in quarantine. Everything's a blur for me, so I'm assuming it's the same for everybody else. I can't believe we're at July 10th. I feel like our whole spring was kind of robbed from us, and I still feel like I'm functioning back in March, and it's amazing to me every time I write the date down. So we were in quarantine way back the end of March and into April. And the reason why we did it was to quote unquote flatten the curve. Why do we care about flattening the curve? Because what we wanted to avoid is what is about to start happening here, which is that we wanted to allow, well, there were a couple of things we wanted to do. So one is we wanted to allow the healthcare community to get more of a grapple on this disease. And one of the good things is that is occurring. And we see that, and that's one of the reasons why our death rate is not exponential at this point, is because we are we are constantly learning every single day something new about this disease and ways to combat it. And so the medical therapies, which we pretty much at the beginning didn't know what the heck to do to try to have people survive. And at one point, we're actually doing things that were not helpful because we didn't know how to treat the disease. Now we're getting treatments, and so people are surviving. But remember one thing: what happened in New York, and the reason why there were so many deaths is because the system got overwhelmed. And so the point of flattening the curve is allowing time so that everybody is not getting sick at the same time. With our numbers going exponentially through the roof, that's what's about to start happening. Everybody's getting sick at the same time. What does that mean? That means the hospitals are not going to be able to support that number. So then that's when you start to see your death rate start to go up. Because if you have people who are ill and with COVID or anything else, heaven forbid, but that are sick, and then they cannot get a bed in the hospital, and more importantly, if their health is declining to the point where they need to be in an intensive care unit and they can't get that level of care, they can't get the oxygen or the intubation if that needs to be. Yes, we've come a long way. Our goal is not to intubate at all, if at all possible, but there are people with COVID that still need to have intubation because their lungs are not going to be able and their bodies are not going to be able to function without it. And if there is no bed for them, then those people will unfortunately die. And so that's when the numbers start to go up on the death toll exponentially. And that's what happened in New York. There were no beds. There were no ICU beds. There was no place for anyone to go. And so the people that would hit the emergency room, they would end up not making it because of that. So we don't want to see that happen in Florida. I can tell you that the ICUs are full. Overall, the numbers are up. The hospitalizations are up. Hospital numbers vary at this time of year. They vary throughout the year anyway. And so the hospitals will get to max capacity at various times during the year anyway. So then add COVID on top of that. I did speak to uh, some of the doctors and supporting staff in Lake County because a lot of people think Orange County's over there. Orange County has the horrible numbers. Orange County has the COVID. We're good. We're good over here. And so Um, Lake County is smaller, and so that's why our numbers are less. But Lake County is still having its issues. The hospital is South Lake Hospital is full. It doesn't mean you can't go. They are making room. They are finding places to put patients. And the COVID numbers actually are not that high at South Lake Hospital. But what's happening, and what a lot of all pretty much all of the hospitals are seeing, is because of all that's gone on in the last several months. What we have is people who have not been able to get into their doctors because the doctor's offices are not keeping the same hours or what have you, and they're getting sicker. So we have people that have medical problems that haven't been taken care of the way they should be taken care of because of fear, because of lack of access, because of whatever, and now they are now extremely ill, and so they're in the hospital as well. And so we've got our sick people who are not COVID patients, but if those beds are occupied by them, then once again, it doesn't matter who's occupying the bed. It matters if there's a bed available. So right now, as I said, the hospital at South Lake is fairly packed, but it's not packed full of COVID patients. There are COVID patients there. There are more COVID patients there than were there, a month ago, way more. But it's not that the whole hospital has been turned into a COVID ward or anything along those lines. Right now, I think that there are only, I don't want to misquote, but there are less than 10 patients in the intensive care unit at South Lake Hospital that are COVID patients. I do want to say it's probably less than five, as I recall the numbers correctly. So but you just have to understand that how those numbers work. And I am working on getting an epidemiologist to come in next week, hopefully, to talk to us about the testing in details and about the numbers and the differences between the tests. I know I've gone through it with you guys, but maybe I can get somebody that's quote unquote official that maybe can break it down to you even better than I can. Um, Oh, I guess I did not go over the Orange County versus the Lake County numbers. Let me just go over them real quickly. Um, uh, Orange County is up to almost 16,000 cases. There are 15,869. That is up over 6,000 cases, 5,000 cases from last week. 1 week, 1 week. One county. The number of hospitalized is up to 536 patients with COVID, up from 470, and the number of deaths is up by 19 from last week. Doesn't sound like a lot, but once again, if it's you or one of your loved ones, that number is very scary. The Lake County numbers, we're at 2,274. That's up from 1,584. So we've seen a huge spike. That's almost 1,000 clients that have gone that we've diagnosed in the last week, guys. The numbers of hospitalized up to 145, the number of deaths up to 26. Median age 40 in Lake County, and now remember, Lake County is actually an older county. If you incorporate North Lake County, we're a huge retirement community. So the fact that the median age for COVID is 40 tells you kind of how this disease is spreading, and that this is actually our young people who, hi Eileen, who I think once again, because of all the different information that's been going around, and I'm not blaming, I mean, I think it's been everybody. There's just been a lot of he said, she said, they said, and then it changes all around. Once again, we had a lot of young people who felt like they were bulletproof and that they could go out and resume pre-COVID activities, go back to the quote unquote old normal, and that everything would be okay. And that's what we're seeing, that they are getting ill, they are getting infected. And then once again, not only the hospital they're seeing COVID in all age groups now. So and first the data was that pregnant women didn't seem to be any more susceptible. They're actually seeing increased illness in pregnant women, especially after delivery. So it is important. pregnant women should consider themselves high risk, and if you weren't already, and you should kind of definitely stay home. Hi, Beth. And so it's not, like I said, a 40 age group for us is in Lake County is a big deal considering our normal skew. Orange County's numbers are even worse as far as the age group. They're at 33, whereas the state in all of Florida, the average age is 40. So we're definitely at a younger age group within Florida, as far as those that are testing positive. There has been now, because of all the testing positive, that has now generated people are kind of taking a little bit more attention to it again, and realizing that they need to take it more seriously. And so the testing has become a big glut. If you are interested in getting tested in Lake County, it's at real if in South Lake County, it's at Real Life Center Church, and it's through the health department. They are saying that people are lining up as early as 3 a.m. And that if you're not there probably by 7 a.m., you're not going to get testing, because they run out of kits. The lines astronomical before they even open up. So just be aware of that. For those that are my clients, we actually do have COVID testing available for our clients that wish to be tested. Now, we can't handle a huge volume, but if you are interested in that, you may contact the office and we can see if we can get you tested next week. Update on our office, we actually had a concern that a potential COVID exposure. So, if for those of you that may or may not have noticed, we were closed this week, and that was once again for your safety and because it takes forever to get our COVID results back. So it took over a week to get the results back to say that we were negative, so that we could open. So we will be back open for regular business, as far as being open for regular business hours next week. As you guys know, I do the telehealth on Mondays and Fridays. So as far as a practitioner that'll be Tuesday, Wednesday, Thursday of next week. Oh, I guess Friday too. So we will be back to functioning with our new norm as of next week. So hopefully that is helpful for you guys. As far as what's going on new in the uh, treatment, etc. Hold on one second, guys, because I just want to check something. Okay. As far as what's new, so you probably heard that our schools are planning. They're planning to open these schools in the fall. Obviously, parents are welcome to school their kids if they want to. It's not going to be a mandatory thing that the kids return, but our governor feels like, and across the country so far, that the having the kids back in school is a go at this point. Um, I don't know. I'm kind of torn both ways on that. I do believe that we need. I do believe, yes, you can come get your blood work done. The I do believe that our younger children, they need to be in school if it's safe. And I think they will know in the next couple of weeks. But for those of you that don't realize, Florida schools start the second week of August. So we're really talking a month from now, which is kind of scary. I feel like, once again, like I said, that we kind of missed. I can't believe it's summer. It doesn't feel like summer. It doesn't, we're just kind of in COVID time, which is a whole different time frame. So it's not our normal summer, or it's not our normal spring. But, we're all in this together. And like I said last week, our ancestors survived the Spanish flu, and so if they can do it, we can do it, and we just have to just take one day at a time, one step at a time to go forward. The remdesivir is a medication you may have heard of, and that one they're seeing really good results with treating COVID patients, and so they're working really hard to get that here. in Florida in copious quantities. They are actually utilizing it in treatment. And I was going to get Dr. Evans to come on today and kind of give us an update on what's going on from a hospital standpoint. But he's actually in surgery right now, I do believe, with a COVID patient. If he frees up before we get off the call, then I will bring him in. And if not, then we will try to get him on next week with an update on what's going on in our Central Florida hospitals. Um, the convalescent plasma, we've talked about that, and that is being utilized as well in the patients. And that's one of the reasons, once again, why we're seeing a decrease in the death rate. So, well, not a decrease, but that the death rate isn't going exponential. And that's because we do have some newer treatments that seem to be working. Is it 100%? No. So don't think, okay, well, I'm great. If I get COVID, I'm good. I can just go in there, get this medicine, and it's all going to be okay. Also, the other thing is that once again, there are some, even if you are asymptomatic, that's a blessing. It's wonderful. And we hope that, first of all, our goal is not to get COVID. But our second goal is if we get COVID, that hopefully we're asymptomatic. We don't have any visible symptoms. Um, but the but there are things that when they're doing studies on patients who are quote unquote asymptomatic, they are still finding that there are COVID changes that are occurring, and we don't know what the long term effects of those are. So when you hear people talking about herd immunity and let's just go ahead and just get it, I mean, I will be the first to say, I mean, I was kind of betwixt between feeling like, you know what, I almost wanted to get it if I was one of the lucky ones that didn't get bad symptoms, so I could just be done with it and be hopefully on the other side. Because that waiting for the other shoe to drop is just a really scary thing every day, and I do believe that it really weighs on all of us, and definitely as a frontline worker, it definitely weighs on us. But I think everybody feels it, and it's a strain even if you don't think it is. So I kind of wanted that, but at the same time, even if you're not having symptoms that you think you're having, when they're doing CT scans and they're doing brain scans, they're actually finding that in these patients that are quote unquote asymptomatic, that they can have changes to their lungs and to their brains and to the gut. I mean, we're just seeing all sorts of things. There are weird skin reactions. So there's stuff out there going on that it's just a bad disease. That's just the bottom line. So I would not deliberately aim to catch the COVID just to kind of get it over with. If you can avoid it, you should avoid it because you don't know. You don't know if you're going to be one of the lucky ones, and you don't know what the long term effects of, like I said, having the virus are going to be. One of the new things that's out that hasn't gained popularity yet, but hopefully, one of the good things about social media is maybe we can put some pressure on some people since we seem to be good at that, for better or for worse. But there is, just like we're using the convalescent plasma to treat the severely ill in the hospital, there's a group of scientists who are working on an injection that would could be used in high risk people like frontline workers to give them some temporary immunity, so boost up their system so it's resistant to the COVID on at least a short term basis. The vaccine is kind of like what they use with hepatitis A, and it may not, it's not like for like you get the vaccine. It's not a vaccine, excuse me. It's not a vaccine, so it's a injection to boost your immune system, but it's not a vaccine where it's going to keep you from um, getting, ever contracting the disease. But it's good for short term therapy, and so we're hoping that so far. My understanding is that they've kind of been poo-putting it because they know that the big drug companies know that the vaccine's coming, and so they know that whatever they spend money on developing right now, if it's just a short-term fix and there's a vaccine out in 6 months or whatever, that the cost effect may not be worth it to them. So that should not be the way that it's done. I think prevention is really, really important, versus so it's important to treat the ill, but with our numbers going through the roof, if we can prevent people from getting it, especially our frontline workers and our high risk people who are more susceptible to contracting the disease, then I think that we should be doing that as well. And I don't think it should be an either or. I think it should be able to be both of them. Um, the uh, oh, hold on, wait a minute. I just got some info, so let me see what it says. Oops, it just went away. So my office manager just sent me something. You should just, Kathy, you should have just posted it on the comment line versus sending it to me. She just sent me a novel, but something along the lines of the rapid COVID test is 85% accurate, and then they will follow back up and do another one to confirm it if it comes back positive. But they can't do that many of them, and it's only done at the hospital. And Advent Health is treating about 20,000 patients a day and will be increasing to 40,000 patients a day. That's talking about all over the whole system of Advent Health, which is one of our biggest. Within Central Florida, we have two big healthcare systems, which is Advent Health, and the other one is Orlando Regional. So anyway, yeah, okay, so the rapid test is at CentraCare. Okay, so we got Lena on. All right, so, you guys can correct me. You can give out information. I mean, I am not by any way, shape, or form saying that I am an expert. We just, it's all about us sharing together and getting the information out. So, anyway, I'm all distracted. What the heck we were talking about before I got all those messages. Oh, we were talking about the injection. I think I told you guys last year, seems like it was last week, that there's a oral pill that they're looking at that will hopefully prevent COVID, both getting it but also being having it absorbed. We've already gone over the immune protocols when we had Dr. Potty on, and I can tell you that especially after our COVID scare, I have been really, really very diligent with all of my supplementation. I was doing it before, but I'm really doing it now. And so I'm doing my colloidal silver at least 3, if not 4 times a day, and all of the other vitamins because the goal is to try to keep from getting this, and if you're going to get it, once again, to have your body respond appropriately and fight the COVID versus succumbing to some of the negatives that go with it. Other things that can help. So we talked about decreasing stress, and that, like I said, is really important for your immune system. The other thing is that a lot of people don't think about is hormones, and hormones can actually help your immune system as well. And so, for my clients, they know that progesterone, I always call progesterone your huggy hormone, and progesterone is really good for calming, for relaxing, and for sleep. And when you're sleeping, you're actually building up your immune system as well. And so that's the time when you actually produce your killer T cells, which are what fight off one of the things that fights off your infection. So that's a really important thing. If you're in that perimenopausal time frame in your 40s, 50s, or after, in the menopausal time frame, having your hormones balanced is one of the things that you can do to help to boost your immune system. And testosterone, once again, is really good for inflammation, and we know that one of the things that we're dealing with here, right, is an inflammatory response. So there's definitely some probable benefit to testosterone therapy as well in the inflammatory response. And once again, it also does help with sleep and with stress as well. And so having good hormone balance can be a positive thing in boosting your immune system, not just for COVID, but for everything. So getting on good vitamin supplementation, being on good hormonal therapies, balancing out your system, decreasing your stress, having more sex to decrease your stress. All of these things are really good. Oh, and the latest thing, that's the last thing I was going to tell you guys. The latest thing actually is that they're looking at CBD. And they're saying, or cannabis, because basically what they're saying is that it actually is really good for the inflammatory process. So they're not saying, there's nobody out there, please don't go out there and tell anybody that I said that they're using it to treat COVID, because they're not. What they're saying is that, because once again, all these articles are swirling, everybody's talking, there's lots of information flowing that normally wouldn't flow, but because of the need to get data out, things get released way sooner and stuff like that. So they are interpreting it out and saying, because of the anti-inflammatory properties that CBD has, that and THC has, that it should be helpful in fighting the inflammatory process. They know that CBD can help to decrease the reduce the interleukin 6, which is one of the things that stimulates that whole hyper inflammatory process, that you may have heard of, that we call the cytokine storm, which is what is one of the things that is actually killing some of the COVID patients, where the patients aren't dying from the actual COVID. It's their immune system attacking the COVID and then going into overdrive and not being able to calm that down. So the CBD is able to do that. CBD versus cannabis, well, CBD is legal, at least here in Florida, and I think in most states. Whereas cannabis, unless you have that, special license, you're not going to be able to get that. So yes, you could probably do either one. But if you, the beauty of the CBD is that if you get some good stuff, it's not mood altering, for better or for worse. And like I said, it's readily accessible, and you don't have to worry about the legality of it, because it's certainly THC or cannabis is definitely illegal in many states still. Now the thing is if you're gonna go out and buy it, CBD's oil is really not dangerous. That's actually quite fine. Please be aware. Most of my clients know. I did a lot of yeah, CBD oil is great. And I did a lot of research on several different CBD oils before we settled on um, the ones that we have in the office. Um, Lena, my nurse practitioner, and I are like, we're THC magnets. So we can tell when there's when there's THC in the CBD oils. So a lot of people don't realize you can get CBD oil, unfortunately, at Bed Bath and Beyond. And I'm not bashing, I love Bed Bath and Beyond, but it's at the checkout counter. And I'm sorry, the quality is just not going to be there. So just because it says CBD oil, don't remember there's no regulation on this stuff. They can have up to 3% of THC in there and call themselves pure and say that they don't have any THC. But 3% is enough. It's not enough to make you feel high and happy, but it's enough to make you feel weird. And it's enough to make your drug test be positive potentially. So you really need to be careful, especially if you are working in any industry where you're going to be tested, because if you don't want to have a positive drug test, then you need to be careful about what CBD you get. And when I get a product that has THC in it, I just feel weird. I always say it almost makes me feel like I'm like how you feel when you first come off a cruise ship. You're just kind of like, it's not even like dizzy. It's just kind of like things are just kind of a little bit further away. It's just kind of like a weird feeling. I don't like it. Lena doesn't like it either. So we can always tell when somebody comes in and tells us that they've got this great pure CBD oil, and we try it, and as soon as it hits right away, I'm like, nope, you've got THC in there. And they swear to God they don't have any. And so the goal is to feel better, not worse. The goal is to have as pure of a CBD oil as you can. So yes, you can run out if you want, and you can buy some from the regular drugstore to get started. But I highly, really recommend the one that we have. So if you're interested, contact the office. I don't have it on the website yet. I've been working on it. It's just been really crazy, really busy. So my goal is to have that. The link on our website, which is, Your Body in Balance Claremont, under products, hopefully uh, early next week. So if you guys are interested. And I think that's about it for this week, unless anybody has any questions. But at least the good thing with this is that we have some people looking into some alternative therapies that are not dangerous. We have some simple things like if the CBD oil comes through, and once again, they're not saying that it's going to cure COVID. They're not even close, but that this is something that you can do that's safe. And also for those of you that don't know what else CBD oil is utilized for, we've been using it with clients. It helps with anxiety. It helps with stress. It helps with sleep. It helps with joint pains. It helps with those are the main things. I'm probably missing some stuff too. But the main thing is that so obviously the reason why it helps with the joint pain is because it helps that all that inflammatory process, which is what we're trying to extrapolate out and say that that's why it would help with the COVID. So even if you weren't using it for COVID. Just like when we talked about the colloidal silver, even if you get the colloidal silver and for some miracle, COVID disappeared in the next 2 months, which would be a blessing, but I do not think that that's going to happen. Then it's not like you're going to waste it. So this is not just a COVID therapy. It's something that you can utilize in your arsenal of healthy things. And as see Beth says, it definitely works. And I can tell you, we utilize it. I tell people, my husband will tell you that he thinks that everybody's on it. He thinks I sneak it in his drink. But I have the cat, the dog on it. It keeps my cat, it keeps harmony in my house. It keeps my daughter level headed. I mean, it really, really works for that calm factor. And definitely with joint aches and pains, it's really good. And it's much better than taking all these other horrible drugs that are out there that we take every single day, right? And so um, with a lot of people, they're able to get on CBD oil and they're able to stop a lot of other drugs for pain, for inflammation, for sleep, and stuff like that. So if you're on a good CBD oil product, and it comes in pills as well, and creams for like the pain. Now that wouldn't be good for the COVID, but if you're on the oil or the capsules, then it can help a lot of other things, not just COVID. So I'm gonna let you guys, no side effects. If you're on good stuff, there's no side effects. If you're getting side effects from your CBD oil, then you have once again you don't have pure CBD oil, and so you should not. There should be no side effects. There just shouldn't be. So if you're feeling weird, if you're feeling sick or anything like that, remember once again, like I said, there's no regulation on over-the-counter stuff, and so they could be putting anything else in there. And they also are probably not getting all the THC out, and that's what you're noticing because I can definitely tell you like from earlier trials on different CBD oils where we had people that didn't feel well. Also, if you're not getting a result from the CBD oil, don't just say, I tried it, it didn't work, it didn't help me sleep, or it didn't help my joint pain. It's probably garbage. And so remember, once again, a lot of the stuff out there over the counter is garbage. And so, you have to be on a good product and you can increase the dose. And a lot of people don't know that. So, you start off, and if you're using, let's just say, first of all, 250 milligrams is too low for anybody. My cat and my dog are on 500 and they're like 20 and 16 pounds. But if you're on 500 and it's not working, you just increase the dose. I mean, and so it does work. If you're on a good CBD, it will work with it for inflammation, for pain. And it's just a matter of dosing. And once again, we can certainly do a consult, and I can help you out with all of that. All right, ladies and gents, it is now 37:42 minutes, and I keep trying to say, I'm trying to get it down to a half an hour. I haven't pulled it off yet, but we're going to get there. We're getting closer, closer, closer. So I'm going to let you guys go, and I will see you next week. Please, please, please. I know there's all this controversy about the mask. Just wear the mask. Just wear it. Just wear it. Because we're now looking at being threatened with a potential second shutdown, and that will kill us. That will kill us. That will kill the economy. I can tell you, I'm a small business owner, and the thought of having to shut our office back down again, I don't know that we can survive that. And so we really need to do anything we can to try to keep our economy open. So I don't care if you believe that there's COVID out there. I don't care if you think that mask wearing is the biggest waste of time in your life. Either stay home or wear a mask. And then at least even if it's hogwash, that you've done your part. in trying to keep the economy open, in trying to get our kids back to school in the fall, in trying to keep Disney open and your restaurants open so that you can go where you want to go and do what you want to do. The definition of insanity is doing the same thing and expecting different results. If you want to go out there and you want to do whatever you want and you don't want to wear a mask and you don't want to maintain physical distancing, then we're going to end up back in a quarantine or worse. And so if that's what you want, if that's your goal, then you're doing a really good job of succeeding with it. But if you'd like to maintain things and hopefully have things get better with our economy and better as far as our access to being going back to normal activity, then do your part. So thank you very much for tuning in, and have a wonderful weekend. I know it's storming pretty much up and down the East Coast, but get as much sunlight as you can. That actually helps to boost your immune system. Put your feet in the grass, the sand, the mud, whatever you can find to be one with the earth. And I will see you guys next week. In the meantime, either stay home, wear your mask, stay healthy, and stay safe. Take care.